I really don't like to go to the doctor unless I have to, so I let my natural defenses cure me. But how long is too long to stay sick?
You know, it's not exact, but in general, the uncomplicated cold is going to last somewhere between 8 to 9 days, all right? 25% of colds can last up to 2 weeks, and then finally 10% 3 weeks.
And that leads us to this question. Should you medicate or not? Take a look at these best friends who have very different views on the topic.
I feel terrible, but I'm gonna fight this naturally. I'm gonna get through it. I don't like to take medication. I like to be natural. I figure the cold's gonna happen, why fight it?
Take medicine. Don't be afraid to take medicine. It's good for you. It'll help you. I like to take anything I can get my hands on. I mean, why be sick if you don't have to? I think these are important. You have to have these.
No, I figure like my body is like a machine. It's so healthy.
Right.
Why
you have Olympic genes.
I do have Olympic genes.
Who's right?
Joining us now is Karina and her best friend, Mark, the machine. The body machine. So how long, Karina, have you been saying, Mark, you have to take meds, my friend?
You know, I've been telling him for years, and I tell him, like, the best thing to do is to prevent it. Just take it before it starts.
Take what before it starts?
Cold remedies, just anything to help speed up the process of not getting sick or, like, having it be, like, a day or two.
All right, so I'm going to show you something on the magic wall. The fact of the matter is this. Nothing that you take, no medication, is going to cure a cold or shorten its duration. But what happens when you get infected with a cold virus? Usually it enters a mucous membrane, your nose or your eyes. What you're going to see here is a little virus coming in. It literally penetrates the cells that line your nose and your respiratory tract. That's when you start to get these symptoms. Well, Karina was saying, take medicine for these symptoms. Well, the fact is, medicines do have side effects. You start getting a little bit of a cough. Well, typically cough suppressants are the treatments. You see some of these side effects. You have to ask yourself, is that side effect worth the possible treatment? What are other possible treatments? Well, you get fever, aches, pains. Common treatment, non-steroidal anti-inflammatories, things like ibuprofen. Again, sometimes people have a great response to it, but understand there are some side effects. It can affect your platelet activity. How about that sneezing, the runny nose, antihistamines? Anyone who's taken antihistamines knows it can cause some drowsiness. It can cause dry mouth. And one more I want to cover, congestion. Decongestants, one of the most common elements of cold medication. But if you have heart problems, understand decongestants are going to likely increase your blood pressure, increase your heart rate. If you take one right before bed, insomnia, restlessness, anyone ever had that where you take one, you're like, oh my gosh, what did I do? But the biggest thing is when you're combining all these things together, you just need to be careful because they all have different side effects. And if you take a couple of different ones that have the same side effect, it can accentuate it. And here's what I really want to emphasize to everyone. With a cold, I'm not talking about bacterial infections, I'm talking about cold virus infections. Your body's immune system, these are white blood cells, will eventually take care of that virus, eliminate it from your body. Medicines are not going to change that process. They may just change some of your symptoms. The medicines are for one thing only, to treat your symptoms. None of those medicines are treating the cold virus. That's why a lot of people say, you know what, go the natural route. We always talk about nasal saline washes, things like that, because hydration is one of the things that you can do, right?
Yeah, that keeps the mucus nice and moist, keeps it flowing out of there.
So eating foods that may boost your immune system.
Rest.
Yes.
And so what I would say to you, Karina, is if there are over-the-counter medicines that you know work for you and make you feel better, then that's absolutely okay. Mark, if you don't like taking medication, I don't tend to take medication when I have a cold, and that's what you like to do, that's fine too. Yes. Just for people out there, understand that there are side effects. Make sure that they're safe, particularly if you're someone, like I said before, suffering from heart disease. Your doc may say, look, avoid decongestants because it will boost your blood pressure, et cetera.